are you doing today? My name's Cassie, I'm going to be your nurse today. So I got a doctor's order and we're going to change wound dressing on your leg according to the doctor's orders. Are you Miss Moxie Java? Yes? Alright, perfect. Well, have you ever had your wound dressing changed before? You have? Okay, perfect. Alright, so I'm just going to do a quick little assessment. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever, where's your pain level right now? Just like a 1, so this is a little bit there, but not much. Alright, perfect. Is that normal for you? Alright, so I'm going to verify. We have to do double check to make sure we know who you are. Can I get your full name and your birthday? Perfect. Alright, so I'm going to go ahead and wash my hands, and then I'm going to come over and we're going to get started. Raise your head up a little bit. So the last time you had your dressing changed, did you need any pain medication? No, you were good? Okay. Well, if you need anything or you feel a lot of pain, let me know and I can do my best to get you out of pain. Alright, so I'm just going to double check. Alright, so your wound is on the lower part of your right leg. Alright, so I'm going to cover you up with this. This is just a bath blanket. Just going to keep you warm so I can get your sheets out of the way, but that we still keep you covered because you got to be uncovered, at least part of you, for this procedure we got today. Alright, let me know if you need anything. Go ahead and uncover you. Okay. Now for part of this procedure, it's sterile, so I'll let you know right before we do that, but I'm going to need you to not move, try not move today, okay? Alright. So I'm going to go ahead and put this under your leg. This is just a protective barrier. It's just going to keep your bed and your sheets clean. Alright, does that hurt your leg at all? No? Okay, perfect. Alright, so right now I'm going to go ahead, and this is the trash bag. So I'm going to place it right under next to your feet. Once again, I'm going to ask you to try and not move, just because then it messes up, and if we need to, we don't want to spill all this stuff all over your bed. Alright, right there. Alright, so I'm going to lower your bed back down. I'm going to go ahead and wash my hands one more time, and then we'll really get started here, okay? Okay. I would wash my hands again. 20 seconds, make sure you get all clean. That's dry. Another one to turn it off. Alright, I'm not going to clip up yet. Are you still doing okay, Miss Java? Alright, perfect. Let me know if you get get the chills or anything. Can't talk today, can I? gonna go ahead and raise your bed up again. Don't worry, my gloves are clean. Just put them on. Alright. Okay, so I'm gonna go ahead and assess. Go ahead and take off your old bandage. Go ahead and find the end of it, huh? There we go. Alright, if this starts hurting you, let me know, okay? Little piece of tape there. Alright, perfect. Alright, so there is a little bit of serosanguinous fluid there. Alright. So I'm going to go ahead and take a look. And it looks like your wound is right about 9.8 right to 10 centimeters long. And right about 7 centimeters wide. Alright. So, at this point, I'm going to take off my gloves. I'm going to lower you back down. I'm going to wash my hands again, and then we'll really get started on putting the new wound dressing on there, okay? Are you still doing okay in your pain? How are you? About what level are you on? You're still at only a 1? Okay, perfect. Alright, so I'm going to wash my hands again. Alright, dry. Alright, dry them and then take a new one, turn it off, throw it away. Alright, so raise your bed up. At this point in time, we are going to do a sterile field, so I'm going to ask you to try and hold as still as possible, okay? Alright, I'm going to ask my assistant to push my glasses up real fast. Thank you. Alright, so remember to try not to move for me, alright? I'm right here, don't worry, I'm not leaving your side, I'm just taking a step over here. Oh, gloves broke. Alright, now I'm gonna have to be really still because I'm all gloved up now. Alright, here we go. So I measured your wound and you're all good. So I'm gonna ask my assistant here real fast if they will lift up your leg for me, because I have another sterile barrier here to put underneath your leg. Okay, perfect. Go ahead and set that down for me. All right. Takes just a second, Miss Moxie Java. I'm going to make sure that I get all my supplies ready first. All right. There's that. Just a little bit of a tedious process, ma'am. But I'll hurry up and get it done as fast as I can so you can relax the rest of your day. This gauze is not as thick as I would have liked. How are these? Are you still doing all right, Miss Moxie Java? How's your pain? Are you still not in any pain? Still at a 1? All right, good. All right, I'm almost ready. All right, just 1 second here. Okay. All right. Alright. So I'm going to start here, and I'm just going to go ahead and clean your wound out now. Alright. Alright, so your wound is all clean now, so I'm going to go ahead and start I'm going to check it real fast. Alright. I'm just going to go real fast and check for any tunneling, or any abnormalities in your wound. Alright, I'm not seeing any. Alright, you are good. And it looks to be that your depth is at about 0.8 of a centimeter. Alright, so we're going to go ahead and pack your wound now. Not everything has to come with us. I'm going to go ahead and start packing. If you feel any real tenderness or anything, you let me know, okay? Okay. So I'm going to go ahead and put on a couple of dry pads here. Alright. At this point, I'm going to ask my assistant if she will lift up your foot for me real fast. Thank you, ma'am. Alright. And we are going to get you all wrapped up here, and then you will pretty much be done. Thank you, assistant. Alright. So at this point, thank you. You may set her leg down now. I'm going to ask her to grab me a piece of tape while I make sure I know where the end of your dressing is here. Are you still doing okay? There isn't any tenderness or anything there? No? Okay, perfect. All right. Thank you, assistant. All right. So you are all bandaged up, my dear. All right. I'm going to go ahead. Can you lift your leg up for me? Yes. Perfect. Thank you. Go ahead and get this pad out of the way. You didn't have any extra leaking or anything on there, so that's always good. Gloves are stretchy. I am sorry for that, ma'am, and I apologize. Alright, are you still doing alright? Still no extra pain or anything? Perfect. Well, you are quite the trooper and great patient today. All right. I dispose of. Okay. So, I'm gonna go ahead and open this. We'll get rid of all of your garbage here. Okay, so let's put my stuff in there. All right, so your pain is still at just a 1, like you said? All right, perfect. All right, now I will clean up my station here and put your bed back down. All right, so I'm gonna go ahead and take this and make sure I get you all nice and covered up with your blanket. All right, well, if you need anything, you let me know. Here is your call button. We will come back to check on you in a little bit, see if you're still doing okay. All right, and then I put this in the dirty clothes basket. And this would go into the biohazards designated area. All right, I'm gonna clean up my mess real fast. All right, ma'am. If you are still doing all right, just get some hand sanitizer. All right. Well, if you need anything, you let me know. I give you your call button, and you have a great day, Mrs. Moxie Java.